My name is Cassandra Ledman. I'm a clinical associate professor in the Department of Health and Kinesiology at Purdue University. So both modes, running and walking, provide substantial health benefits. But the most important question is going to be what individuals do consistently. So what's been proven is that all-cause mortality and numerous other disease risks will be substantially reduced if an individual is consistently participating in an exercise over time, consistently over their lifetime. So the general recommendations from the CDC are to aim for obtaining 150 to 300 minutes of physical activity at a moderate intensity per week. Now that's ideally divided over obtaining physical activity and exercise most days of the week versus piling it all onto 1 or 2 days. So 5 days a week, progressing to 5 days a week of about 30 minutes would complement that goal. And the key is, though, if you haven't been exercising, to progress with starting with maybe 10 minutes of activity in a day to adding to that over time. There are a lot of health benefits to walking that actually are very comparable to some of the health benefits noted for running. And these range from mental to physical health benefits, mental health benefits such as decreased stress. You have heard of the substantial stress decrease that participating in exercise can provide, but beyond that, it also can actually significantly reduce anxiety, depression, and also decrease onset of Alzheimer's and the severity of Alzheimer's. There's also a lot of evidence from the physical side when it comes to cardiovascular disease risk, metabolic disease risk like diabetes, even people coping with arthritis and osteoarthritis, rheumatoid arthritis. Exercise can provide some relief or even some protective benefits to those conditions as well. Walking has other additional benefits beyond the health benefits because it's simple, it's very accessible, and it's very effective still. So you can sneak a little walk in a little easier than you can sneak a little run in your day. So really trying to walk every day, even if you are running, is actually really important. So running is a really efficient activity. So while walking and running have a lot of the same overarching health benefits, the efficiency of running cannot be ignored. So while somebody would take longer to walk and obtain the same caloric expenditure than somebody who is running. So really good, just an example of this would be like, say, a 175-pound individual that went and ran at about 6 miles per hour for 30 minutes would expend about 420 calories. But if they were to walk for 30 minutes at about 3.5 miles per hour, they would expend about 140 to 150 calories, which is quite a big difference. Running does have a pretty high injury report rate. Now this is anything from a very mild to a very major injury, and being about 45% of runners reporting injury versus other sports are closer to that 10% margin. But the reasons why this is the case and the way you can kind of reduce your chances of becoming injured are by progressing appropriately when it comes to how often you're running, how far you're running, the intensity that you're running at. Also making sure you have appropriate attire and footwear, making sure you have appropriate recovery and nutrition as a part of the equation as well. That's often overlooked, and that goes for any exercise, is making sure that you balance the amount of work and recovery and progress slowly over time.